Hello, everybody. Welcome to Dr. Tom's on Tuesdays at 10 in 10. Holy cow, it's November 10th. Check that out.
Hey, about that.
So,
something about being a 10. Now, I've never been a 10, but we'll go with 10.
So
maybe a 6 or a 7, but I'm sure not a 10.
The purpose of this is to get tips from Dr. Hirsch regarding how to effectively utilize and take advantage of the system. So today's tips are around tips on helping clinicians get the most out of the Isolite that they've already invested in and they may or may not be using. So Dr. Hirsch, how are you, sir?
Rolando, I'm great. Welcome, everybody. It's good to talk to you on Tuesday the 10th. Here we are post-election, and we'll see how everything goes. But that's a whole nother discussion.
Yeah, that's
anyway.
So what advice?
You've spent your money. Thank you very much. I really appreciate your purchase. I want to talk to you about helping you get the most out of your Isolite. First and foremost, the most important thing about utilizing the Isolite that surpasses anything that you can do is have the Isolite set up in each one of your operatories. Make sure that it is there, ready to go and ready to use. So all that you have to do is pick it up, put a disposable mouthpiece on, and put it in the mouth. That's my number one primary tip. Have it there, ready to go. What I have found over the years in going to so many conventions and having so many people come by and talk to me, and they said, I'm just not utilizing it the way that I should, the way that I know I should. I said, well, why is that? He said, well, I've been saving it for special occasions. Well, this is not a special occasion mouthpiece. This is not an occasion where you've got a deep class 2 restoration on tooth number 1 way in the back of your mouth, and you've got to get isolation. This is for everyday procedure. So have this thing out and ready to go. Pick up a mouthpiece. It takes you 2 seconds. If you have to get it out and set it up, you're not going to use it. So don't even bother. Have it ready to go. That's the number one tip. Number one.
Make it available. Awesome.
Okay.
Cool.
Number 2. Here's tip number 2. You've got to educate your team. So when you get the Isolite, it's not just you, the dentist. Hey, this thing comes in. Boy, I got this great thing. It's going to reduce aerosol. It's going to really help me. Educate your team. Have a lunch and learn with them. Just sit down and talk to them. We at Isolite will be more than happy to get on the phone with you and talk to your team through this. But have a good talk with your team about what the Isolite is and how it's used. Another thing that is really important to do along those same lines of education is I've got tons of online videos that you can look at with your team or by yourself, or let your team go look at them in pertinent information that's pertinent to them, whether it be hygiene or sealants, crowns, fillings, bondings, implants, oral surgery. Just have them look at each one of these videos and spend some time educating yourself and your team. Okay, that's the second tip. Third tip, the next thing that you need to do is use it on your team, or let's go before that. Have your team take this thing and try it in their mouth. Make sure that everybody tries it in their mouth. They can see what it feels like. You can see if there's an impinging area, where that might be. You can see if there's an area that needs to be trimmed, where that might be. You'll get a feel for what the patient is going to experience. Any dental product that I've ever purchased, any medicament that I've ever used, I try it in my own mouth first. I want to taste it. I want to see what it feels like so I know what the patient is going to experience. Some of these things that we have are really nasty, and you need to know how to circumvent the nastiness of different medicaments. Let's just take the Isolite. You need to know how to use it and how to learn it and where the issues might come. So try this in your mouth. Try it in your staff's mouth. Let them get familiar with how it feels. So that's what they can do. And they can try it in on each other. That's part of this whole lunch and learn thing that you'll get together and do with your staff. And then the other thing that you need to do, call it tip number 3 or tip number 4, use it on a real life procedure on your staff and or yourself. If you're getting your teeth cleaned and your hygienist is cleaning your teeth, put it in your mouth so you can see what it feels like, what the experience is like. This is what I've really found and heard time and time and time again, is the patients that have been coming out of hygiene, getting their teeth cleaned, say, that is the most comfortable cleaning I've ever had. They rave about it to me, which they come into my room and I'll do the exam, or even if I'm doing it in the hygiene room, they will actually rave about how comfortable it was and how easy it was and how much more they enjoyed having their teeth cleaned with the Isolite than without it. So yeah, tip number 4, experience it. Experience it on yourself and have your team experience it. My team, if they need any work and restorations, I put it in their mouth and they love it. And they will give you feedback. They'll tell you what's good about it. They'll tell you what's bad about it. Not everything is a perfect scenario, and sometimes there's some bad stuff about things too. So you want to know the pros and the cons of the entire system.
This is great. So make it available so that it's
Yep.
not something you have to expend energy on.
Yep.
Second piece, educate your team. I love that. And you're right. We have a lot of resources to do that. I mean, you've already invested in the system.
Yeah,
Third,
absolutely.
use it, place it, use it on yourself, and then use it on procedures for your team so that they understand the patient experience that your patients are dealing with.
Right,
So
right.
anything else? Any other tips to help in kind of showing practices who already have the system how to be more successful with it? Anything else?
Well, just like I said, the very first thing, set it up.
Set it up.
How many times have we bought something and it sits in a drawer? Yeah, I'm so guilty of that. I go to the convention and I'll buy something. Of course, we're not going to conventions anymore. Or I'll buy something online and the thing comes and it just kind of goes off to the side. You got to get this thing rolling. You got to get this thing rolling in the first couple of days that it gets into your office. Set the damn thing up. Get it in there. Get it installed.
And practice, you'll know very quickly if it works or if it doesn't. So, and if it's there,
well, what you're going to find out, I already know that it works. So it's not whether it works, if it works, if it doesn't work. You're going to know right away how well it works. And what you're going to find out is how much of a time savings it can give you. I mean, things just go easy with it. Heck, at the beginning of an appointment, if I'm taking intraoral photos, I will put this thing in the mouth for intraoral close-up photos. It's really great, cheeks out of the way. My camera's not fogging. I can dry an entire half arch off and take individual pictures of each tooth with my close-up camera. And it's fabulous. It's fabulous for that. Okay, fine. And cost me $3 to take a picture. Okay. From that diagnostic standpoint, from what the patients can see, you'll make that back 1,000 to 10,000 times over.
So also, Dr. Hirsch, with the fact that cases are coming back up, with the fact that COVID has not gone away, again, droplets, spray, spatter, aerosols. It's very effective in conjunction with an HVE. So I'll throw that in there.
That's a good one. Doesn't look like COVID's going away anytime soon. We may have some remedies out there for us, but certainly not a cure. So it's here for a while, and we have to work with it, and we have to protect everybody in our staff. And here's the thing that you also have to do. You have to be somewhat flexible with things too. For instance, I have a device in my office right now that I'm spraying patients down. I spray the room down with it, and it's been my protocol. Every single patient, without fail, gets sprayed down with this particular device. Just this morning, I had a patient, brand new patient to the office, and she was sitting in the chair, and my staff is getting ready to spray her down. And boy, she's, nope, you're not spraying me down. Well, why not? Oh, I've got asthma, this and that. So I educated her and told her, well, this is nothing more than a hypochlorous solution that I'm spraying you down with, and it's safe. It's electrolyzed salt water. It's not a problem. And she said, no. I'll go home and I won't be able to breathe. So you know what? You've got to be a little flexible here.
Right.
You sit there, you make a decision, and I'm trying to convince myself and convince her, well, look, this is for my protection, your protection, for the patient that's coming before you, for the person that's coming after you. And then all of a sudden, you can't force things down people, so you've got to be a little flexible too sometimes.
Awesome. Dr. Hirsch, thank you so much for that. Make it available, train your staff, use it on them, use it on yourself, get comfortable with it. Appreciate that. Sir, have a wonderful, wonderful rest of your week. Please be safe and look forward to seeing you again on Tuesday. Yep. Folks, if you have questions for us, or if you need information, or if there's anything, please send them to us. Check out all the other tips online. Thank you, Dr. Hirsch, for sharing Dr. Tom's tips at 10 in 10 on Tuesdays at 10 on the 10th.
I love it, Rolando. Rolando, you do such a great way of summing everything up. You know, you take all of my thoughts that are scattered all over the place and you really sum them up so nicely. Thank you so much. And everybody, thanks a lot. Watch those videos online. They're very helpful.
Appreciate it. Thank you, sir. Take care. Bye-bye.